Hi, I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. In this video, we're going to attempt to tie together some of the concepts that we've discussed in earlier videos. I'm going to go through an admission from start to finish, beginning with placing the admission order, going through entering an order set, completing a medication reconciliation, and then finishing off. Back at the patient chart, looking at the banner bar, we can see that we have a 60-year-old patient who comes in with a history of cough and fever. The patient's been assessed, and we've determined that the individual also has a pneumonia. Looking at the problem list that was perhaps created by the emergency room physician, we see that he has a few other chronic problems, including some mood issues and ADHD, which aren't really relevant to this admission, so they've been marked as chronic. He also has type 2 diabetes, which could play into the current treatment, so we've included this as chronic and also relevant for this visit. But the key admission diagnosis is pneumonia, which is for this visit. Now we'll start with a common source of confusion with doing admissions. The first step in any admission is submitting an admission order. This is different than an admission order set that has all of the medical information and tests and treatments. The admission order is just an order essentially to admitting at the hospital to assign this patient in and get them a bed. There are a couple of ways to do this. Virtually everyone will have these built into their quick orders, and I can see here that I have that built into mine. The other way, of course, would be to search for that order. So going to inpatient workflow, a new order entry, one could just simply search for admit, go to the end, because that is where all little order sets are, and we'll find patient admit orders. This goes up into our to-do box, and our first step will be to go ahead and do the admission. Now there will be details in this, as in many orders, and this is the pop-up that you will get. You can admit to outpatient mental health, but in this case we're admitting to inpatient, and we because there's a little blue X, we know there's further information required, so we'll set to modify. We will enlarge this screen so we can see what we are doing, and we can see the required fields. Required fields always end up in yellow. Fields that are not colored in can be filled, information can be entered, but is not required. You have to deal with the yellow ones to proceed. So bed type, this is a patient with pneumonia, so we'll admit to medicine. Service type, there are many options, but here it will probably be to medicine or to the hospitalist program, and we see here medicine, so that's fine. Most responsible provider, I will make myself the most responsible provider, so I'll search for me. I'm not sure why it doesn't default to the person who is doing the admission, but that's the way it's set up. So now I am the most responsible provider. And request bed assignment. This is always a source of confusion. You choose direct admit when you are admitting to the floor from your office. Otherwise, we're asking for a bed assignment. So in most cases where you have a patient in the emergency room, the answer to request bed assignment will be yes. Now we can see that we've dealt with all the yellow, and I will go ahead and initiate that. We're remembering that things also need to be signed. So now we have an active admission order, and the hospital administration can start finding a bed for this individual. Now that we have admitted the patient, we're going to want to enter some orders. In the live environment, we will have a large number of disease-specific order sets to choose from. In this case, we would choose a community-acquired pneumonia order set. In the train environment, unfortunately, there's just a limited number of order sets present, so we will go with the medicine admission order set, the general one. So we'll type in a few letters. We'll say medicine, and at the end we see the order set, medicine admission to medicine. So we'll choose that, and that goes into our to-do box. We may as well get started working on that, so we'll click there, and as this is a long order set, there will be many details to modify, so we will click modify details. Now, starting at the top, at the beginning, the resuscitation status or goals of care. This is what many of us used to call the DNR status. This is significantly different than what we're used to and probably warrants a bit of attention. This is the model that Windsor has been using with great success for the last few years, and matches well with best practices province-wide. So if we look at resuscitation status, we can select an order sentence. Resuscitation is what we generally refer to as all measures. Comfort care is generally just what it implies. Interventions only to make the patient comfortable, as would be found in an end-of-life situation. But as we'll see, we can be more specific about what we mean. And medical generally means something in between. Now, the nice thing about the goals of care is that it allows us to specifically state what interventions the patient wants and what intervention the patient doesn't want. So take, for example, this patient. Perhaps he has significant long-term problems and doesn't feel that he wants an ICU visit. One could indicate that here. More likely he would want an ICU visit. So we'll click that. And then we have a drop-down list which goes through the various interventions that we talk about when we're setting out goals of care. Does the patient want to be intubated or ventilated? How about inotropes? How about surgical interventions? So it allows us to choose any or all of these as things that the patient wants, and provides a much more detailed view of what the patient desires than what we've had in the past. So for argument's sake, in this case, we'll say he wants everything done, so we'll click all. All right, that's fine. Let's move on. Moving through the rest of the order set, we can choose as we will. The patient would like a regular diet. They can do as they will activity-wise. Vital signs. Again, we have a drop-down list. The nurse would probably be annoyed if we asked for Q1 hourly vital, so perhaps we don't want that. So we'll go with Q shift and PRN aside from that. Oxygen therapy, we can decide whether we want goal of over 92 or 88 to 92, perhaps if he's a CO2 retainer. So we will go with that. Keeping in mind that one always has the option of specifying any goal that you want. So if I wanted the patient to have greater than 95, that is certainly within my range of possibility. Any of these orders, even with the drop down, you can modify them and be as specific as you would like. Moving on down, we have certain preset orders. If the patient has chest pain, get a cardiogram. If you don't like that order, it's a simple matter of removing the check mark. Now, we move down to fluids. In different situations, you could have any number of different fluids, and we see here the icon with the two different pizza boxes. As you may recall from one of the earlier videos, that this icon means that there's a subphase, which is really an order set within an order set. So if we click here, this isn't a true order, but it will bring up another order set. And here it is, a big list of all possible, or many of the possible IV fluids. In this case, perhaps we'll go with just normal saline. We can choose our rate with common ones here, but remembering you can modify and put in any rate that you want. But for convenience, the common ones are present here. So I've chosen 100. And that's fine. Now we see an added pop-up here. There are no yellow fields that need to be filled in, so we can just ignore that. That's a complete order. Now we've chosen our fluid. Now I want to get back to the main order set. So we can click on the button to return to the main order set. And away we go. Now, moving down, next major section, we have VTE prophylaxis. If you do not fill this in, you will get a pop-up, so probably best to fill it in. In this case, the patient may be immobile for a little while, so we're going to go with just enoxaparin, and perhaps we'll give it twice daily. Once we have chosen the enoxaparin, we can return to the admission order set and move along. Analgesics, Tylenol is generally a good idea, so we will choose that. We can decide whether we want to give any pain medications. Again, we have an order set, and we can choose whatever we feel is appropriate. Perhaps we'll give them a little bit of immediate release morphine if they're feeling uncomfortable, with the option for some injectables. So we'll go with that, and we will go with this as well, maybe 5 milligrams. Moving on, we want to return to the general admission order set and move on. We want something for their bowel, so we'll I see the patient's on some opioids, so we will use the opioid routine, and we'll just accept that as given. And the patient is not a smoker, and we are not going to deal with vaccines just now. Now we need to order blood work. We'll order some basic stuff for the next couple of days. And we will decide if we want some liver functions, which is a subphase. So we'll click that, and this gives us the basic liver functions pre-checked. Return to the general admission order set. Now, we're going to want some investigations. I'm sure we're going to want some blood cultures. Patient has pneumonia, so we may want some sputum cultures as well. And I see on the general admission order set we don't have choices for sputum. Now, anything that is not present can easily be added. We click Add to Phase, add an order, and then we can search for the order that we're looking for. So I will put in sputum, culture. That seems about right. And we see the order come up, specimen type, how foolish, a sputum culture is obviously sputum, and then we are ready to move on. So, very good. We look to see if there's anything else that we want to do, and then perhaps we would like to have our respiratory therapists come by and see them, so we'll click for them. They're going to want a reason why, and perhaps we're going to have them see for shortness of breath, so that's fine. So we've done all of our orders. We have not ordered any antibiotics because this is a general admission order set. So we're going to go add to phase, add an order, and we will choose what we would like. So perhaps we'll go with some ceftriaxone. So we'll put in a few letters and spell it incorrectly. There we go. We'll give a gram. And we'll also go with azithromycin. And maybe we'll give that 500 the first day. And we'll also order it for 250 for the next bunch of days. So there we go. So the antibiotics are added. Now, we can see that we've developed a few little blue X's, which we know mean we have further information required. They want an indication. So we're going to go with community-acquired pneumonia, and I imagine that will be the same for each one. So we deal with our little blue X's fairly quickly. So that's good. Now, we appear to have gone through all of our orders. We seem to be fairly happy with this. But we can't forget that the patient probably has their own medications from at home. And we can see here that someone, hopefully a pharmacy tech or something of the like, has done a medication history. So our next step would be to figure out which of those medications to continue and not continue. So that's, of course, our admission medication reconciliation. So one thinks one can check on that. That is not the case. That simply tells us that we have a job yet to do. Now we're going to move on and look at medication reconciliation. There's a few places that you can do this from, but a good place would be to just go to home medication. And we can see that this patient has quite a lot of different things that they take at home. They take some things for mood, they take some vitamins, they take some muscle relaxants. It looks as though they take some a medication for diabetes and ADHD, as well as some bowel drugs. So there's quite a selection here. So we need to go through those and decide what we're going to continue and what we're not. So in this case, we are going to go to our medications, and this gives us the same list that we had before about showing us that the meds history has been done. But when we're centered on medication, we can actually click and begin the process of doing our medication reconciliation. And we see here quite a long and busy list, but what essentially we have to decide is what we want to continue in hospital and what we don't. So we have here all of the patient's home medications. So we will go ahead and say we'll continue with the medications for mood. The patient isn't really due for any vitamins, so we will not continue that. We will continue through the rest of the list until it has been completed. So there we go. We have done our medication reconciliation. These will go on to our inpatient order list, and these will not, but as we will see in a future video, they will reappear when we do our discharge medication reconciliation. So we will we've done our reconciliation, and we will sign this. And we have a pop-up which says, my goodness, this patient is allergic to codeine. Do we want to continue? We see that the patient takes any number of other narcotics without any difficulty, so yes, we do want to continue. And the reason is it's my clinical judgment, and that the patient is already tolerating this medication. So we'll move through that pop-up. And we get a second one for the same thing, for the hydromorphone. Patient's already tolerating. And we get a third pop-up for the other hydromorphone. This, you will find, will be a steady source of annoyance in Cerner, but they're easy enough to click through. And there we go, it's now happy. So we have signed, we're moving on, it's processing happily away, and there we are. So now would probably be a good time to go back and review our work, so let's do that. A nice place to review our orders would be from the dark menu, and we can look at either all of the medications on the medication list, and if we didn't want to do that, we could look at all of the orders, and they're laid out for us fairly nicely to review. If we have forgotten anything, we can certainly add by going to the add button, but in this case we'll say that we are satisfied with our work and are ready to go onwards. So this video has reviewed the basics of doing a completed mission. In our next video, we're going to go to the other end and do a discharge.